second dose just now, and the allergy. So I have sulfur drug allergy. So they wanted to observe me for 30 minutes. So 30 minutes is just finished. I have my second Moderna dose done. So hopefully soon I will be fully so I think I'm fully vaccinated. The protection is what we'll see. And then again, we all know that the efficacy for every vaccine is not 100%. That means, for example, the Moderna is 94%, which means out of 100 people, 6 can still become ill with the COVID. So there is no protection yet. I'm going to keep doing the face mask and IVM and lufimectin and other things. But here I am done, and this is the vaccinated, and this is my red dot, and this is Mubin. So thank you very much for everyone. Thank you very much for those who said don't get it out of a concern and love for me. I don't think that they mean anything, any harm. They are, this is the way they cared and loved. And those who said that, yeah, please go for it. Thank you for everyone, and here I am. They said that the side effects would appear tomorrow. So I guess what I'll do today is I have two main tasks to do today. One, the Dr. Pierre Corey video yesterday, he asked me that his editor is busy or he can't find him, so I have to edit that. So cut it out and join these two together. So I think I'm going to do that, and I would like to do the live as well this evening. So I hope I don't develop the side effects today. If it is tomorrow, then I would be off, depending upon the side effects. I'll try to be live, but if not, then I'll be off for the whole day tomorrow. Wish me luck. I hope I don't become too ill, but I think I'll be fine. So these are the two things that I'll do today. Thank you very much for everyone. Thank you for kind wishes, for prayers, and thank you for staying with me throughout this journey. Did you notice that the cool beans are the coolest audience? You can check the audience for any other doctor, and you would see that this audience is the most curious, most informed, and most open-minded. So I'm very, very much proud of this. So thank you very much, and I would see you this evening. So I have to figure out how to get out of this. So there are some questions, so let's see. So there was a question, how long do you think natural antibodies hold up, as well as do they with the variants? So Dan Ban, the natural antibodies for the SARS-CoV-2 have been seen to be about for 8 months for sure. For SARS-CoV-1, they had seen them to continue on for 2 years and then decline in the third year. And the T cell immunity with SARS-CoV-1 has been seen to last for 10 years. So if we extrapolate that, then that would mean that this one should also have a similar outcome. And the vaccine-induced antibodies should have a similar outcome too. So natural infection or that. So Scotty Bean, how are you? Mary, so there is a question, if I take 25 milligram ivermectin, should I take 12 milligram in morning and 1 in the evening? So Aditya, first I'm hoping that you have done your dose calculation. And secondly, yes, if you wanted to divide it into 2, you can. Boca says, will you get killer T cell immunity from vaccine? I had read only this type of, you had virus. Yeah, so some people would develop T cells, some people would predominantly develop antibodies. So vaccine itself cannot drive one way or the other, but it depends upon your own immune system. But yes, you would develop both kinds of immunities. Arun says, so you are supposed to take vaccine after 6 months. I do not know if a booster is needed, but we'll see as the time passes. Maro says, hello from Florentine Bean. Hello, Maru. How are you? You are from UK. Thank you very much for signing in. Get Good says, why are you proud of taking the vaccine though? Isn't it under tested? No. So vaccine has its own trials. We understand what the trials are. Yes, you can say it is under tested, that it is not out there for decades. But at the same time, they've been administering it to hundreds and millions of people. I am very happy to take it. Sandy Thompson says, my cardiac consultant was impressed with my knowledge about options for anti-inflammation. I mentioned your channel. Absolutely. Sandy, this is one difference that we have from everyone else, may it be Medcram or Campbell or whoever else. We, the cool beans, are very informed and they are deeply knowledgeable. So I think we are the ones, we are a small group, but we are the ones who really care for the mechanism and understanding of the medical concepts. So Christine says, glad all went well. Hope any side effects you may have are minimal. Me too. Christine, thank you. S-Sun says, congrats, got my second Moderna weeks ago. Also, awesome, great. Hope you're doing good. Did you have any side effects? GB says, good luck, Dr. Bean. Christine says, thanks for checking in. Absolutely. Thank you for signing on and leaving a comment. Jahangir says, sir, why is it necessary to check blood pressure before vaccination? It's not necessary unless somebody has some pathological situation and you want to make sure that they are okay before the vaccine. Faizan Ahmed question, which pathway is better for vaccine, cytotoxic or T helper? And how body decides which pathway it goes. So this is a very complex topic. We are actually not clear that how does the body decide. We know various interleukins that would help go one B cell or cytotoxic T cell. Secondly, you thought from your question, it seems like you feel that T helper cell is a different pathway than cytotoxic. T helper cell pathway is engaged in both cases, and the pathways are humoral immunity or cytotoxic, that is antibodies or cytotoxic. In many infections, both are kicked in. One may be dominant, and so can a vaccine decide which way to go? I don't know. Johnson & Johnson said that we go predominantly towards cytotoxic pathway, but interleukins can be given to move it one way or the other. We don't really know how does this happen. Aditya says, question, I take 2 pills of 12 milligram in the evening instead of 1 in the morning and 1 in the evening. That is fine. That is fine. As long as you take it with fatty meal or meal, which allows it to be absorbed in the blood, then it would be useful for COVID. If you take it empty stomach, then it is useful for any COVID in the GIT, for example. Somebody just called me sheeple. That is so good. So Mariam says, sheeple, trust the government. Nice. Then Rupam says, how long does protection from Moderna last? So I just talked about it, that in theory, from the previous infections, SARS-CoV-1, it should go on, antibody protection should go on for 2 years and then 1 year for decline. And then T-cell protection should continue for even 10 years. So we don't know exactly how far would it go, but that is the previous one. The studies on antibodies with actual infection have shown the protection to continue for 8-9 months. Cool. So Anna says, thank you, Dr. Bean. Bless you, Dr. Bean. Thank you very much. So I'm going to now hang up. Thank you, everyone, for signing on. I have my second shot done. This is the, if I move the camera to the other side, can I do it? Yes. So this is the vaccination center here. People are coming in, they're getting vaccinated, and this person is backing out. Let's see if they come and slam in. No, so they're doing good. Okay, cool. So good. I know that you have lots of questions. My apologies. I would go at this time. It's about 10 minutes now. I don't want them to kind of freak out that, hey, what are you doing sitting here making videos? So I'm going to go. I would try to log in this evening and we can do question answers. Maybe if I'm not feeling that great or if I spend too much time editing Dr. Corey's video, I may not have time to prepare. So let's talk this evening, and thank you very much, and I would see you again. Bye-bye for now. Thank you very much for your love.